Hello, my name is Afira Elbo. This is NR 509, Advanced Physical Health Assessment. I will be assessing my patient here, Heather, today. Before I introduce myself, I have washed my hand and I have created privacy for the patient. So I'm going to go ahead and introduce myself to my patient. Hello, Heather. My name is Afira Elbo. I'll be doing your exam today. How are you doing today?
I'm good, thank you.
Okay, first I'm gonna start with inspecting her face. I do see she has slight discoloration and slight acne, but all looks good. I do note that her head is midline and symmetrical. Next, I am going to be palpating her lymph nodes. I'm gonna begin with the pre-auricular lymph nodes. Then I'm gonna go to the post-auricular lymph node, which is behind the ear. I'm gonna go down to the back of her head, which is the occipital lymph nodes. And I'm going to come forward to the tonsillar lymph nodes. Then I'm going to come towards the jawline to the submandibular lymph nodes. Then the submental lymph nodes. I'm going to go down her neck to the anterior cervical lymph nodes. And then the posterior cervical lymph nodes. Then I'm going to come down to her clavicle, which is the supraclavicular lymph nodes. And I do not feel any enlargement, and they're equal bilaterally. Next, I am going to be testing trigeminal nerve, which is cranial nerve number 5, and it has two components to it. It has the sensory and the motor component. First, I'm going to start with the motor component. I'm going to start by palpating her masseter muscle. I'm going to ask her to clench her jaw, and then I feel she has great strength, and I don't feel any distortions. Next, I'll be testing the sensory portion of her trigeminal nerve by asking her to close her eyes and let me know where she feels my touch. Close your eyes, Heather. Thank you.
Forehead, left cheek, right cheek, nose, chin.
And those were all intact. She felt my touch in all sections of her face. Next, I am going to be testing her. I'm going to ask her to test cranial nerve number 7, which is the facial nerve. I'm going to be asking her to do different expressions for me. I'm going to ask her to smile. I'm going to ask her to frown. I'm going to ask her to puff her cheeks out. I'm going to ask her to raise her eyebrows. And I do know it's symmetrical. Next, I'm going to be assessing her ears. But before I do so, I'm going to inspect her ears to see if she has any lesions or nodules or tendon. Is it a tender?
No.
And they are symmetrical. Next, I'm going to be looking into her ear canal with my otoscope. I am having technical difficulty. My otoscope just stopped working with the light, so I'm going to use this to look into her ear canal. I'm going to tilt her towards here. Okay. I'm going to pull back and up. And I'm going to insert my otoscope. And I do see that her tympanic membrane is pearly gray. She does have a little cerumen, but there's no drainage or redness. And there's no effusion in the middle ear. Now I'm going to look at her left ear. I'm going to pull up and back. And I see that her tympanic membrane is pearly gray. There's a little cerumen. There is no effusion in the middle ear. There's no drainage or swelling or redness. The ear looks good. Next, I'm going to be palpating her pinna for any nodules and tenderness. Any tenderness or nodules?
Nope.
Next, I'm going to palpate her tragus. Any tenderness or nodules?
Nope.
And there's no tenderness noted. Next, I'm going to be testing her acoustic nerve, cranial nerve number 8, also known as vestibulocochlear nerve. I'm gonna be performing. It's just for hearing, and I'm going to be performing a whisper test. I'm going to ask her to occlude one ear and let me know what I say in the other ear. Occlude your left ear, Heather. Love is beautiful.
Love is beautiful.
Okay, I'm going to go to the next ear. You are beautiful.
You are beautiful.
Thank you. Hearing is intact bilaterally. Next, I'm going to be inspecting the eyes. I am going to first begin by inspecting her eyes. I'm going to pull down her eyelids to look at her conjunctiva. I don't see any drainage, redness, swelling, or lesions. It's nice and pink. And I know that her sclera also is white and clear. Next, I'm going to be testing cranial nerve number 2, which is the optic nerve. I am going to be testing for central vision using the Snellen chart. I'm going to stand 6 feet away from the patient and ask her to read the lowest line possible. I'm going to ask you to occlude one ear for me, Heather. On one eye for me, occlude one eye, and let me read the lowest line possible.
LTFPH.
Now, occlude your right eye. Read the lowest line possible.
LTFPH.
Now, let's use both eyes.
LTFPH.
Okay. LTFPH, which is she has 20/20 vision in the right eye, 20/20 vision in the left eye, and 20/20 vision in both eyes. Thank you, Heather. Next, I'm going to be testing her, inspecting her cranial nerve number 2 also. I'm going to be doing an optic nerve, but this time I'm going to be testing for peripheral vision. I'm going to ask Heather to stand up for me. Sorry, I'm going to move in the table. And I'm going to ask her to let me know when she sees my hands. Do you see my hand right now?
Nope.
Do you see my hand?
Yes.
Do you see my hand right now?
Nope.
Do you see my hand?
Yes.
Do you see my hand right now?
Nope.
Do you see my hand?
Yes.
Peripheral vision is normal. Next, I'm going to be testing for cranial nerve number 2, which is the optic nerve again for pupil response to light. I'm going to get my pen light. And I'm going to ask you to look at my nose. And I'm going to bring my pen light towards the eye, and I'm watching as it constricts. Okay? I'm going to go to the other eye, and I'm watching as it constricts. And it does constrict. It's 2 to 3 millimeters. They're round reactive, and they're equal to light by equally. Next, I'm going to be testing her. So I tested her eyes optically, and I'm going to be testing for the other cranial nerves, which is cranial nerve number 3, which is the oculomotor nerve, cranial nerve number 4, which is the trochlea, and cranial number 6, which is the abducens. And I'm going to be using an H pattern to test for her extraocular movement of her eye. I'm going to ask her to follow my pen as I do so. And as I'm doing so, I'm looking at her eye movements, and they are controlled. It is following my light. EOMs are intact. Thank you. Next, I am going to be inspecting her nose. I'm going to start by looking at her nose. I'm looking for any obstructions. I don't see any, no fractures, and no redness. Next, I'm going to use the otoscope to look inside her nose. I'm going to tilt her nose up and back. And then I'm going to be looking at her turbinates, which I see. They're moist and pink. Her nasal septum is slightly deviated. Do you have a deviated septum?
Yes.
On the right side?
Yes.
Okay, so I do see it. It is slightly deviated, but there's no redness or bogginess in her nasal passages. I'm going to go over to the next nostril. One up, tilt up. And I do see her turbinates are moist and pink. There's no redness or drainage. There's no swelling. Her nasal septum is midline and slightly deviated. Okay. Thank you. Next, I'm going to palpate her sinuses. I'm going to start with her frontal sinuses. Let me know if you feel any tenderness. And I'm going to go to her maxillary sinuses. Do you feel any tenderness?
No.
Okay, she does not feel, there's no tenderness noted. Next, I'm going to inspect her mouth. I'm going to assess the mouth and throat, but first I'm going to begin with the mouth. I'm looking at the mouth and I don't see any cracks. It is moist and pink. Now I'm going to ask her to open her mouth. First, I'm looking at her teeth. I see there's no cracks, there's no decays. And I'm looking at her gum. I see that her gum is red, there's no lesions, it's pink and intact. Then I'm looking at her buccal mucosa. I'm going to ask her to open her mouth. And I don't see any lesions in her buccal mucosa. It's pink and intact. Her tongue, stick out your tongue, is moist and pink. There's no lesions or swelling. It's moist and pink and it's intact. Her posterior oropharynx is intact, moist and pink. There's no lesions. And I don't see any postnatal drainage. And her hard and soft palate also, there is no lesions. It's moist and pink and intact and looks healthy. I'm going to ask her to lift her tongue up. I'm looking at the floor of her mouth. It's okay, take a minute. I'm looking at the floor of her mouth and I don't see any drainage or lesions. And it's pink and intact. Thanks, Heather. Next, I'm going to be testing for cranial nerve number 9, which is the glossopharyngeal, cranial nerve number 10, which is the vagus, and cranial nerve number 12, which is the hypoglossal. But we'll not be testing the cranial nerve number 9, glossopharyngeal. We'll test this for gag reflex. I'm going to be testing cranial nerve number 10, the vagus nerve, by asking her to open her mouth and say ah. Open your mouth and say ah, Edda.
Ah.
I do see her uvula does rise with phonation. It's symmetrical and rises in phonation. Thank you. Next, I'm going to be testing the cranial nerve number 12, hypoglossal. I'm going to ask her to stick her tongue out and move it from side to side. You can stick out your tongue and move from side to side. Okay, and it is normal. Next, I'm going to be palpating her TMJ, which is the temporomandibular joints. As I'm palpating, I'm feeling for any crepitus, subluxations, any clicking, or tenderness. I'm going to ask her to open and close her mouth. Okay, so I do note some clicking. Do you have TMJ?
Yes.
Okay, so there is some clicking noted as she opened her mouth. Thank you. Next, I'm going to be inspecting her neck. I'm going to look for her neck for any deformities, any distortions. It is symmetrical, and there's no distortions. The neck looks good. Next, I'm going to be palpating her trachea. So I'm making sure that it is midline. And her trachea is midline. Next, I'm going to be palpating for her thyroid gland by putting my hand finding the cricoid process, and the other hand, it is substernal notch. And between those 2 points, I'm going to put my fingers, and then I'm going to use my other hand, and I'm going to retract. And as I do so, I'm going to ask her to swallow. And as she swallowed, I'm feeling for a rise in the thyroid and any nodules, and I do not feel any. Next, I'm going to do the opposite side. Again, I'm going to retract here. I'm going to ask her to swallow. Again, I do not feel any nodules. I'm going to palpate. Next, I'm going to palpate her carotid artery on the side of her trachea. I'm going to palpate unilaterally and not bilaterally. Okay? Palpate the other side. And they're normal and bounded. Next, I'm going to auscultate the carotid artery. While auscultating carotid artery, I'm going to make sure I ask her to take a breath and hold because I do not want her breath sounds to distort my auscultation. And when I'm auscultating her carotid artery, I'm going to be using a bell to auscultate for any bruise. Okay, Heather, take a deep breath and hold. Breathe. Now take a deep breath and hold. Breathe. I do not hear any bruise. Next, I'm going to assess for the range of motion of the neck. I'm going to ask her to bring her chin to her chest, and that's flexion. I'm going to ask her to look up at the ceiling, and that's extension. I'm going to ask her to look to her left. That's rotation. I'm going to ask her to look towards me. That's rotation. I'm going to ask her to lateral flex her neck by bringing her ear to her shoulder, and that's lateral flexion. And I'm going to ask her to do the opposite. That's lateral flexion. Her range of motion of her neck is intact equally. Next, I am going to be assessing cranial nerve number 11, which is the accessory nerve. I'm going to be assessing by putting resistance on her shoulder and asking her to shrug. And her shoulders are strong and it's normal. Next, I am going to be auscultating the heart sounds. I'm going to be auscultating with the diaphragm and also the bells. First, I'm going to start with the diaphragm. I'm going to ask her to take breaths in and out as I auscultate. I'm going to move the table this way. Okay. I'm going to start at the second intercostal space, right sternal border, which is the aortic. Second intercostal space, left sternal border, which is the pulmonic. I'm going to come down to the third intercostal space, which is the Erb's point, left sternal border. Come over down, which is the tricuspid, which is the fourth intercostal space, left sternal border. And I'm going to go over to the midclavicular line, which is the fifth intercostal space, the mitral. Next, I'm going to auscultate now with the bell. I'm looking for any swishing sounds, any murmurs, and as I do so, I'm going to ask her also to take breaths in and out. Aortic, pulmonic, Erb's, tricuspid, mitral. Thank you, Heather. Next, I'm going to inspect her chest. I'm looking for any deformities, any asymmetry. Excuse me. Thank you. And I do note that it is symmetrical. I don't see her using any accessory muscles. I don't see any barrel chest. Her chest looks symmetrical and looks good. Now I'm going to auscultate for any bruise. So now I'm going to auscultate for her lung sounds. I'm going to be auscultating her anterior chest. I'm going to auscultate in 6 areas. And as I do so, I'm going to ask her to take breaths in and out. Breath sounds are clear. Now I'm going to go to the posterior chest. And I'm going to be auscultating 8 areas. Can you turn this way for me, please, Heather? Okay. I'm going to make sure I start above the scapula and I don't auscultate on her scapula. I'm going to auscultate this area. Take a deep breath in and out. Now I'm going to go to the medial lateral lobe and the medial right lateral lobe. Okay, I do hear a little bit of wheezing, but apart from that, all his breath sounds are clear. Next, I'm going to be assessing upper extremities. I'm going to ask her to stretch out her hands. I'm looking at her joints. I'm looking for any redness, any swelling, any deformities, and I don't see any. Next, I'm going to assess for capillary refill by pressing down on her nail bed and wait until it turns white and then releasing. and I've noticed that it turns pink within 3 seconds, which is normal. Next, I'm going to ask her to turn her hand inward, and I'm going to pop it for her radial artery. And it's 2+ and bounding. Next, I'm going to assess her hand grip by asking her to squeeze my hand. Yeah, whew. Her strength is 5 and 5 and strong. Next, I'm going to be doing the range of motion of the elbow. I'm going to flex and extend. Thank you. Next, I'm going to do the range of motion of the shoulders. I'm going to flex, extend. I'll do it on this arm so you can see better. Okay, I'm going to flex, extend, internal rotation, external rotation, abduction, adduction, and range of motion are intact. Next, I'm going to be unequal. Next, I'm going to be assessing the strength of her biceps and triceps. I'm going to ask you to flex your elbows and push against me. Okay, now pull towards yourself. Strength is 5 and 5. Strength is 5 and 5 and equal. Next, I'm going to be testing the cerebellum. I'm going to be testing cerebral coordination by testing alternating rapid movements. I'm going to ask Heather to please take her thumb and touch her index finger, middle finger, fourth, and fifth, and repeat. As she does so, I'm watching for coordination, and I see she does have good coordination, and she does it well. Next, I'm going to assess for rapid movements of her hands. I'm going to ask her to put her palms down in her lap, rotate, and now do it faster. And she does it well and do well coordinated. Next, I'm going to be testing for the tendon reflexes. I'm going to be testing for the biceps, the patella, and the Achilles. I'm going to get my reflex hammer. Okay, I'm going to ask her to relax her arm and mine. And I'm going to put my thumb on her medial antecubital fossa, and I'm going to strike with the pointy end. Okay, and I see that she does contract. She has a good response. Now I'm going to bring this down. Now I'm going to be testing for a patella. I'm going to ask her to relax her legs. Relax your legs. And I'm going to hit it with the flat hand of the hammer. Oh, she's hyper reflex. Do it again. Okay, she has good response. Now I'm going to take her shoes off, and I'm going to dorsiflex her foot, and I'm going to strike her Achilles. And as you see, she does have pronation. Thank you, Heather. Put your shoes back on. Next, I am going to be inspecting the abdomen. I'm going to ask Heather to lay back down in the bed, go further back. Okay. Now I'm going to expose her abdomen. As I'm looking at abdomen, I see that it's flat. It's not rounded. I just see slight spots on her stomach, which is a little acne. There is no contours. There is no distortions, and it is symmetrical. It looks good. Now I'm going to auscultate all 4 quadrants with a stethoscope using the diaphragm. You're doing good. It is normal active. All vowel sounds are present. Next, I'm going to auscultate with my stethoscope and I'm going to auscultate with my bell. I'm auscultating for any bruise. I'm going to start below the umbilicus, the aorta. Then I'm going to go to the right renal, which is above and lateral to the umbilicus. Then I'm going to go to the left renal, which is above and lateral to the umbilicus. Then I'm going to come down to the left iliac, which is below the umbilicus and left. And I'm going to go to the right iliac, which is below the umbilicus and left. And I do not hear any bruise. Doing great, Heather. Thank you so much. Now I am going to percuss all 4 quadrants. I am percussing for any dullness, tenderness, or tympany. Now I'm going to palpate. I'm palpating for all 4 quadrants. I'm palpating for any masses. Let me know if it's and tenderness. Let me know if you feel any tenderness, okay? All right. Okay. Any tenderness?
Nope.
Okay. Now I'm gonna test the blumberg test by inserting my hand 90 degrees vertically, and on rebound, if she feels pain, it's a positive blumberg test. So let me know when you feel pain, okay?
Mm-hmm.
Any pain?
Nope.
There is no pain noted. Thank you, Heather. Now I'm gonna palpate the liver and spleen. I'm gonna begin with the liver. I'm gonna put my left hand underneath right here. I'm looking at the mid-clavicular line on the right, and I'm gonna place my hand on the cluster vertical angle, and I'm gonna push down. And as I push down and upward, and as I do so, I'm gonna ask her to take a deep breath. And maybe I should feel the edge of the liver, but I do not feel the edge of the liver. Next, I'm gonna do the same. I'm gonna ask her to come lateral towards me. Come lateral towards me. This way, thank you. I'm gonna put my hand behind her right here, and also I'm palpating. I'm gonna place my hand in the cluster vertical angle, and I'm gonna push down and upward. And as I do so, I'm gonna ask her to take a deep breath. And I do not feel the spleen. The spleen should not be palpable. Okay, next I'm gonna assess her lower extremities. Okay, I'm gonna pull her pants up. Okay. As you can see, for Heather's legs, I do not see any edema. I don't see any edema. I don't see any lesions, any scars. It looks good. Now I am going to do the range of motion of her knees. I'm going to flex and I'm going to extend. For the purpose of this immersion, I'm performing only unilaterally, but when in the settings, I have to perform on both sides. Now I'm going to test the range of motion of her hip. I'm going to flex her. I'm going to flex her knee, and in turn, flexing her hip. Then I'm going to internal rotate. I'm going to external rotate. I'm going to extend. I'm going to flex. I'm going to abduct, moving away from her body. I'm going to adduct, bringing towards the middle line. And all range of motion of her hip is intact and equal. Next, I'm going to test the strength of her knees. I'm going to ask her to flex her knees and push towards me. Okay? Now pull towards yourself. Okay. Thanks, Heather. Strength is 5 and 5 and equal. Next, I'm going to test the range of motion of her ankles. I'm going to take her shoes off. flex this way. Okay, so I'm gonna dorsiflex, I'm gonna plantar flex, and I'm gonna rotate. And all is normal and intact. Next, I'm gonna test the strength of her ankles. I'm gonna dorsiflex resistance. I had to push back. I'm gonna plantar flex with resistance, push up. Okay, strength is 505 and equal. You can sit up now, Heather. And before that, I'm gonna actually test her dorsopedalis pulse. And it's 2+ and bounding. Now, Heather, can you please stand up for me? Okay. Now, Now we're gonna be assessing the spine. I'm gonna inspect and palpate for any curvatures, alignments, and tenderness. And I do not feel any. Now I'm gonna ask Heather to bend and touch her toes. And that is flexion. Thank you. You can come back up. I'm going to ask her to extend backwards. And that is extension. I'm going to ask her to rotate left. Then rotate right. That's rotation. I'm going to ask her to lateral flex left. Now lateral flex right. And that's lateral flexion. Her spine or her range of motion of her spine are intact and equal. Now I'm going to assess her gait. I'm going to ask Heather, please walk towards the camera. And if she does so, I know that her gait is steady. Walk backwards, turn around and walk backwards. Steady. She's not shaking. She's walking steady and straight, which is good. Thank you, Heather. Now I'm going to test for the Romberg test. I'm going to ask her to put her hands on her side and close her eyes. And I'm going to, for 20 seconds, I'm looking for any swaying. And as you can see, Heather is not swaying. She's standing still. That looks good. Thanks, Heather. You can open your eyes. Now, I am going to conclude my assessment. I hope you enjoyed this video, and thank you so much. Thank you so much, Heather, for being my patient. Thank you.